This emergency case study. He has fallen from the roof from quite a height this last 12 days. Now what you are seeing is, this is an emergency ultrasound, so I will have to do it in as soon as possible. This is the outer surface of the liver, which is smooth. This is the parenchyma of the liver, which is normal. Here you see the fluid. This is the fluid in the hepatorenal angle. As now you see, this is the liver. Liver is absolutely normal. So far there is no tear or breach seen. The vessels, the portal vein and its branches, these are the anterior and posterior branches from the right portal vein. Liver outer surface is smooth, and if you see, concentrate on this region, you will see floating echoes about in this fluid that is surrounding the outer surface of the liver, and you see that this is these are floating echogenic areas. जी बेटा ठीक है, and this is consistent with the bleed in the fluid surrounding the liver. These waving, dancing structures, echogenic, these are suggestive of bleed. This is the regular thin anterior normal surface of the liver. And यह कौन है सारा? ये जिगर के उत्तर। जिगर से मैंने? जिगर के उत्तर। मैं करते देखूँ। हाँ, मैं सारा देखता हूँ। मेरा बालू खोली। उतो नहीं आओ, इधर नहीं। उत्ते चढ़ जाओ। दसम किसों निकल गया? वेख रहे हैं जी, उन दबना पड़ेगा। So the liver is itself normal. There is no tear in the liver. This is the gallbladder. This is the gallbladder, which is also normal. And this is the right. This is the diaphragm, right hemidiaphragm. There is no evidence of fluid above it. No pleurophurin seen. The kidney. This is the right kidney. This one in longitudinal section. This is normal. Capsule is intact, no internal injury seen. So now this is fluid, straight away just below the costal margin, and the bowels are floating in this fluid. These are the bowels that are floating in it. The fluid in this section is different. Then the fluid बेटा तुम खाना आता है? ना है। And this is the fluid in which you can see. This is in the all of the abdominal cavity totally. Hardly any fluid area is spared. This is bleed within the fluid, and now in this portion we see a bit clear fluid with very little echoes in it. These are the bowels. These are the bowels. This is the bowel. This is all fluid, and these echoes are representative. The spine floating echoes are representative of bleed this is the, and now I'm in the pelvic region. And you see how the bleed appears. कोई नाली तो नहीं पाई उन्होंने? This is the urinary bladder in which you are seeing a lot of echogenicities. This is the urinary bladder, and these are calcifications or clot formation. This is, and they are giving posterior shadowing, so most probably these are charcoaline. However, possibility of clots cannot be ruled out, keeping in view the history of the patient. So this is the transverse section, and this is the longitudinal section of the urinary bladder, in which you see a lot of. Now this is the urinary bladder. This is the boundary of the urinary bladder, and here these echogenic areas, these are suggestive of clot formation within the urinary bladder. पेशाब कर रहे हैं या पेशाब आ रहे हैं?
बहुत जल के बहुत
जल के थोड़ा. Patient is conscious otherwise and is saying that he can pass urine but with difficulty and cannot evacuate the urinary bladder completely. Now this is the left side. Let's see the spleen. This is the total spleen in length with fluid. This is the spleen. Myers 10.4 is normal in length. This is the fluid villicose, and this is the fluid where occurs. This one, rest all are bowels. The left kidney. Cannot move. However, the upper pole of this kidney is normal, left kidney, and here the lower pole is also normal. Capsule is intact, and there is no evidence of any breach or any rupture. So the spleen and the left kidney are normal. Rest all of the abdomen is filled with bowels floating among with fluid. A lot of fluid is being surrounded by. Now this is very typical echogenicity. You see, this is the bleed. This is the bleed. These are bowels. These densely white areas are the bowels, whereas this is the bleed. This is also fluid, but bleed, fluid, but there are no echoes in this compartment. However, this is definitely a bleed. So the patient is bleeding internally, though by ultrasound parameters, almost all structures are within normal. No rupture of spleen or liver, kidneys is seen. So he will have to go through exploratory laparotomy immediately. This is bleed, typical picture of bleed with bowels floating in a clear fluid, as well as within this bleed. Wherever I place the probe, I get fluid. And in the upper abdomen, the fluid is relatively free of equals, this is the upper portion. There is bleed, but there are echoes, but not to that extent, as you will see down here in the pelvic region. You see, this is the just above the suprapubic region. So, see the difference in the fluid. In both images, this is the full of bleed. This is also fluid, well echoes.
ट्रीटमेंट शुरू हो गया
With echoes, which is bleed,
ट्रीटमेंट शुरू हो गया
and this is a clear bleed. So this is the difference between the clear fluid and fluid with echoes, fluid with clot. This is the ligamentum teres. This is the ligamentum teres in longitudinal section, as this is the left lobe of the liver, and as I will move the probe 90 degrees, it will become triangular. Here you are. This is the area. Abdomen is so tense that I really cannot. This is longitudinal section of ligamentum teres. This is the transverse section of ligamentum teres. There is so much of fluid and so tense abdomen that it is becoming difficult to get the pancreas.
सुनने लगेंगे
First refinement. बेटा तेरे पहले ऐसे ही मैं से ऐसे स्पीड से तेरा इलाज होना चाहिए जो मैं लिख के जाऊँगा. This is the tear. This is the area. So ultimately, I have reached the area from where this bleed is possible. The right lobe of the kidney, of the liver is normal, whereas when I go to the left lobe, I do see this is the area. Now this is the area of bridge between the left and the right. This is the right lobe. This is the left lobe. Liver. थोड़ा मैं की करने खपन है थोड़े वास्ते. This is ligamentum teres, and this is the bridge between this area is the bridge between two lobes, and a possible side from where the bleed, this area showing fluid, this area showing bleed, this area. This is the possible area of rupture and bleed. So this is the case of the day. Thank you.